body is made up of a complex array of different cells, much like a crowd of people. The role of the immune system within this is firstly to survey this crowd and identify any threat, and then eliminate any threat that it identifies. This is similar to a scene that we see from Where's Wally, where we must identify the foreign, potentially dangerous culprit, Wally, from a crowd of people. Now, in the immune system, the stakes are much higher. It needs to identify an infection from the masses of healthy cells within the body. How the immune system identifies this? It utilises antibodies. These look for certain patterns on our cells that allow it to target different cells or people, just like we target Wally by looking for his striped clothing, his walking stick and glasses, as we can see in the wanted poster. But sometimes we can get a little overexcited in our search for Wally, and we might focus on, say, his striped clothing and identify many characters within the field. Normally, we would disregard these characters quickly. But in the context of, say, a trigger-happy SWAT team that are focusing on their target, or an overactivated immune system, this may result in the immune response to innocent bystanders. And this is what happens in autoimmune disease. So hopefully you can see that it's not just the targeting that's important, it's how we interpret this. And in the immune system, this is the role of Fc receptors. These bind to these pattern-seeking antibodies and interpret the immune response, essentially regulating the response. Now, this is a large family that are present on your immune cells, and I'm focusing on one such receptor. This is a receptor that our labs identified and named Fc gamma receptor 2A3. What sets it aside is a very small insert in the receptor. It's only 19 amino acids. Now, not everyone actually expresses this receptor. In fact, in the general population, it's quite rare. But in patients with inflammatory autoimmune disease, it appears to be overexpressed. So potentially predisposing these people to inflammatory disease and targeting these innocent bystanders. By further characterising this new receptor, I hope to identify what is actually predisposing them. Is it how they're targeting or how they're regulating the immune response? By understanding this, we'll be able to not only understand its role, but determine whether or not it's a potential diagnostic marker or therapeutic agent in the future. Thank you.